This episode is brought to you by State Farm. Checking off the boxes on your to-do list is a great feeling. And when it comes to checking off coverage, a State Farm agent can help you choose an option that's right for you. Whether you prefer talking in person, on the phone, or using the award-winning app, it's nice knowing you have help finding coverage that best fits your needs. Like a good neighbor, State Farm is there.
Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes I release on Thursdays. A unfortunately common condition, well, maybe not super common, but common enough that we take it very, very seriously is DVT. And we do a lot of things to prevent DVT. So I guess that's why I say it's common, because we talk about it commonly, because we do so many things to prevent deep vein thrombosis, right? We put sequential compression devices on patients. We put compression stockings on patients. We encourage ankle pumps. We encourage ambulation and moving around. We give a heparin. We give a Lovenox. We do all of these things. But if you suspect that your patient has a DVT, the physician is likely going to order some diagnostic tests and look at some things. So let's talk about what those would be. So we're looking at first assessment. So let's say you suspect DVT in the lower extremity. You would have a patient complaining of things like localized tenderness, even throbbing pain in that extremity, swelling, redness, warmth when you touch it, swollen veins that you can touch. They're hard, they're tender to the touch. Those types of things will be part of the assessment. You might measure, if you're looking at the swelling of a leg, for example, you might measure around, oh yeah, it's much bigger than the other leg. So looking at things like that. Now, as far as lab tests go, the D-dimer is a very, very accurate test for looking at DVT, but there's a little bit of a caveat to that. So a negative D-dimer indicates low likelihood of a DVT. So it's basically really good for ruling out a DVT, but a positive D-dimer does not necessarily mean, oh, they definitely have a DVT, because there are other things that can cause an elevated D-dimer, such as DIC, sickle cell disease, malignancy, even pregnancy. So a D-dimer in and of itself is one key part of the picture, mostly if it's negative, because negative can rule it out. Positive is just going to be supportive of that diagnosis, especially if there's none of these other things going on. So if they get a positive D-dimer, they're probably going to be doing some other tests as well, like an ultrasound. So an ultrasound of that extremity can show if there is a thrombosis present. Many, many times this is just done right there at the bedside in the inpatient setting. Venogram is another test that could be ordered. It's an X-ray that includes the installation of a dye, and the dye can show where this clot is located because it's not going to flow through the blood vessels past that clot. And then other imaging studies could be conducted if the patient is actually suspected of having a pulmonary embolism because of a deep vein thrombosis. And those tests include a VQ scan, which is a ventilation perfusion scan, and this test uses a small amount of a radioactive substance that is injected into the bloodstream, and it looks at airflow and it looks at blood flow. It looks at ventilation and perfusion, and this shows areas where blood flow is blocked. Another imaging study could be a CTPA, or computed tomography pulmonary angiography, another tough one to say. This uses cross-sectional x-rays and contrast dye to visualize blood vessels in the lungs and identify clots. And then a pulmonary angiogram. This is a more invasive test, but this involves a catheter inserted into a large vein, oftentimes the femoral vein, that is threaded through the heart. Into the pulmonary arteries. So it goes all the way up through the heart into the pulmonary arteries. The dye is injected and x-rays are taken as that dye is traveling along the pulmonary arteries, showing areas where blood flow is blocked. So there you have it. That's what to expect if you're looking at a DVT for your patient or even a suspected pulmonary embolism. I hope this helped you, and I will see you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Wherever fall takes you, Belk's right there with you, rocking Levi's denim, Sam Edelman boots, and a Michael Kors bag. From the pumpkin patch to game day to dinner parties, you got the vibe. Add a Clinique glow, Cuisinart kitchen helper, cozy Biltmore touches, and suddenly fall's not just a season, it's a celebration. Shop your faves and get the savings you want, in-store or at Belk.com.